shoulder pain that comes and goes. Could it be something benign or could it be something more sinister? Well, watch this video to find out more. Hello, I'm Dr. Aditya from the Shoulder and Knee Clinic, where we discuss various issues related to the shoulder, the knee, sports injuries. And today we are going to discuss something regarding the rotator cuff in this video. So, lot of times people have a complaint कि एक दिन हाथ उनका अच्छे से चल रहा है और एक दिन हाथ बिल्कुल उठना बंद हो गया. Suddenly उन्होंने कुछ heavy सामान उठाया और the dog tried to pull on the leash, and after that they started experiencing pain in the shoulder, and after that it has never been the same. So what is this issue? So to understand this, you need to see the shoulder anatomy. So if you see your shoulder, it's like this. It's a ball and socket joint. There are all these tendons around your shoulder called the rotator cuff. So they are responsible for your shoulder movement. Now, as your age progresses, the tissues in your body degenerate over a period of time. Somebody who is 65 years old will not have the same tissue quality as somebody who is 20 years old. And as a result of this wear and tear, these tendons of the rotator cuff, they also degenerate. Some people may have an inherent problem in the shoulder where there is more contact between this bone above, known as the acromion, and the tendons, which can also lead to tears of the rotator cuff. So typically, these individuals will not have a history of significant fall like road accident or something like that. Typically, the history is they tried to pull some clothes out of the washing machine, or they suddenly lifted a bucket, or somebody pulled their hand, or they got a jerk while traveling in the bus, and then after that they started experiencing pain in the shoulder. The issue is a lot of times people ignore these problems, and that is the worst enemy, because no issue in the shoulder will go away just because we ignore it. Yes, you can wait and watch for a few days, you can take pain medicines, you can apply ice packs on your shoulder, but still, if the issues do not improve, then you should consult a shoulder specialist and seek professional attention. So, what are the signs that you should meet a shoulder specialist? So, one, that you have had some sort of an injury to your shoulder, even if it's very minor, like you pulled on something too hard, or you are just walking and slipped and fell at your home. You are able to move your hand after that, but in a few weeks' time, the hand stopped moving. It may not be that you're not able to completely move the hand in presence of a rotator cuff. Your movements to a large extent would be preserved, but you'll have pain, and also you'll have weakness in your shoulder. So if you're not able to lift any heavy object or do overhead activities after such an injury, then you should realistically consider the possibility of having a rotator cuff tear and consult a shoulder specialist. Also, any pain that has been present since quite some time and you are having restriction in movement, that also may indicate that there is a rotator cuff tear. A lot of times people think it's just frozen shoulder and ignore it, considering that it may improve on its own. But unless an MRI is done, the diagnosis of a rotator cuff or a frozen shoulder cannot be made. So a lot of times we get these individuals who are having shoulder pain since 7, 8, 9 months, and they have been treating as a frozen shoulder, whereas it comes out as a rotator cuff tear when we do an MRI. So what is the importance of early diagnosis and treatment? The importance of early diagnosis and treatment is that if you ignore your shoulder problem, if you ignore a rotator cuff tear for a very long period of time, then it can have devastating consequences for your shoulder. So when we have a look at the rotator cuff as such, there is a muscular portion, there is a tendinous part. Generally, the tears happen in the tendinous part of the rotator cuff where it inserts into the arm bone or the humerus. So typically, this area has a poor blood supply, a poor healing potential. That's why tears happen here. So once a rotator cuff tears completely, then it doesn't stay there. It's like a rubber band. It will start retracting due to the muscular pull. The longer it stays torn, it starts involving the other rotator cuff muscles. So there are principally 4 rotator cuff tendons, and once a tear is present in one of the tendons, it starts affecting the other muscles. They start getting overworked, and that's why a lot of people experience pain in the night also. So a tear which is initially, to start with, maybe around a centimeter in size, can progress in size to over 2 centimeters over a period of 6 months to a year, and eventually the muscular portion also starts becoming weak and starts getting atrophy, and eventually fat starts filling in this muscular part, which is a very bad prognostic indicator. So that's why early diagnosis is important. Now, Why do we emphasize on early diagnosis and treatment? If you diagnose a problem early, you treat it, you are able to become normal. The longer you take to diagnose a problem and to treat it, the more difficult the problem becomes to treat, and then it is difficult to assure somebody that they will have a normal outcome. So when you look at these rotator cuff tears, there are varieties of rotator cuff tears. So one is a partial tear where, let's say, the thickness of the rotator cuff tendon is around 8 millimeters, less than 8 millimeters is torn. So if tears which are less than 50% in thickness are non-traumatic, are likely to heal on their own, whereas tears which are more than 50% of the thickness of the rotator cuff and likely to progress over a period of time. Full thickness tears of the rotator cuff do not heal on their own, and that is where the logic of treatment for these problems happens. So typically, initial treatment for partial thickness tears of the rotator cuff is with physiotherapy and rehabilitation to improve the strength of the remaining rotator cuff muscles, to decrease the pain and ensure that the individual is able to restore the normal function. Now, very important in the non-operative treatment of these partial tears, serial MRI at 6 months interval is recommended to see whether the rotator cuff tear has progressed or is healing. A lot of times people ignore this fact also, and once a conservative treatment is advised, they initially improve but come back after 7-8 years having the problem at a bigger extent. So if a conservative treatment is advised, it's always better to follow up serially to see how the tear has healed. That's very important. Now, the surgical treatment. Surgical treatment for rotator cuff involves a keyhole surgery or an arthroscopy where the torn rotator cuff is repaired back. Rotator cuff repairs, rotator cuff repair surgery gives very good results in terms of recovery of strength, movement, function, and pain relief. The surgery is not big. Typically, you can be discharged the next day of the surgery, as it's an arthroscopy or a keyhole surgery. There is a stage-wise rehabilitation after the procedure, and after the rehab is done, people are able to do all the activities which is appropriate for their age. So when we look at rotator cuff tears which are addressed early, they have a better chance of healing. They have a better chance of full improvement in strength and faster recovery compared to tears which are old, where there is fatty infiltration, where there are multiple tendons torn. There is a higher risk of a re-tear, and even if re-tear doesn't happen, the recovery of strength is unpredictable. So that is why early diagnosis and treatment of a rotator cuff tear is very important. There are certain instances where the rotator cuff tear is so old that the muscle is entirely full of fat. The shoulder also starts developing arthritis. And in those scenarios, it's not possible to repair the rotator cuff. In those scenarios, there is something known as a shoulder arthroplasty, which we do. There is a different topic, and we'll have a different video for that. So, if you have liked this video regarding rotator cuff, do share it with some of your friends who are having shoulder issues, have not diagnosed it. It may help them, and we can help them, treating their shoulder problems better. Do share and subscribe to our channel. Thank you.